Segorine, thank you very much for the opportunity. Osalaze to you as well, and all of our listeners who are joining in this afternoon. So I hope all of you are continuing to do well. Yawangoa, Tareen, and the CKON staff are providing time for me today to provide an update to the community. As mentioned, we're streaming live on the MCA Facebook page and recording to share later on. For our listening audience, today's questions, as Reen mentioned, will only be accepted by phoning into the CKON and not on our Facebook page or any messenger. For today's discussion, we'll provide an update on the current COVID status, current COVID restrictions, and the vaccine rollout. It's now been approximately 10 months since we declared a state of emergency in our community of Akwesasne. I want to acknowledge, as always, that dealing with this pandemic and practicing all of the necessary precautions has been and continues to be challenging for all of us. The recent deaths in our community due to the COVID-19 are a very unfortunate reminder that for everyone, that's why these precautions are extremely necessary, especially for the safety of the most vulnerable in our community. And I want to extend my deepest condolences to all those who've been affected by loss of a loved one at this time. On behalf of the Mohawk Council of Akwesasne, I do want to say thank you to everyone who continues to practice all of the recommended precautions day in and day out in our fight against the spread of the COVID-19 virus. It's really important that us as a community, we do not adapt a sense of security about this pandemic. It's not over, and everyone still continues to be at risk, and we have to continue to be smart and responsible. We have to wear a mask and maintain a 2-meter distance from others when in public, and this is extremely important. A lot of the data showing is that close contact is the main source of transmission. Extremely important that we keep distance from others in public. Well, the number of positive cases in Akwesasne and surrounding area is very concerning. If you recall, at my last update, we spoke about a dangerous time frame between Canadian Thanksgiving and New Year's, which is normally a time of year when we increase socialization and share with our family a meal. And this year, we needed every individual to be especially careful throughout this dangerous period to prevent the spread of COVID-19. The increasing numbers of positive cases that we've seen today and will likely continue up until at least January 15th are a result of social activities and gatherings that have taken place up until New Year's Day. I just want to give a bit of a rundown on some of the cases in the surrounding areas. The Franklin County is now reporting 168 active, which 964 total cases. Franklin County is reporting 906 active cases and have a total of cases of 3,297. The Eastern Ontario Health Unit is reporting 695 active at this time, with a total cases of 1,971. The City of Cornwall is reporting 244 active cases, with a total caseload of 466. The MCA is now reporting 38 cases, and our total cases have been 93. I also want to give a further breakdown of some of the numbers that we have for future, from the past. We went from March to October having very few cases. In November, we've seen 26. December, we've seen 37. And so far, 10 days, 11 days into January, we're at the cases that we are at now of 38. So there have been a significant increase in the last few months. All confirmed cases are considered active until they are deemed resolved by a healthcare provider. This breakdown shows that MCA is currently reporting 38. We have 93 totals. 55 have been resolved, which leaves the 38 active cases. On December 11th, the MCA reported that we received confirmation from the Eastern Ontario Health Unit that 3 staff members of our Junkanusade long-term care facility on Cornwall Island tested positive for COVID-19. In line with our infection prevention and control protocols, all residents and staff members were tested and there were no further positives to report up until December 15th, and testing still continues to happen on a weekly basis. On December 31st, a total increase of 13 new cases within Akwesasne had been reported since December 21st, with 6 being Junkanusde residents. At that time, we have had an overall of 53 and 40 being resolved. As far as in January, we now have an increase of 21 cases, bringing the total of overall to 93 and 55 cases being resolved. Excuse me, it's 38 new cases with the total being 93. 50, and there at this time, excuse me, we unfortunately are reporting 4 deaths at the Junkanusde long-term care facility. Again, as a constant reminder, to reduce our chances of being infected or spreading COVID-19, we have to regularly and thoroughly clean our hands with an alcohol-based rub or wash them with soap and water. It's important not to touch your eyes and nose and mouth. Make sure that you and people around you follow good respiratory hygiene. Wearing a mask or other face coverings in all indoor public places. Maintain at least 2 meters or 6 feet distance from yourself and others. Avoid or limit any activities that put you in contact with anyone outside of your household. Extremely important that we stay within our household bubbles. Stay home and self-isolate even with minor symptoms such as a cough, cold, mild fever until you recover, and please have somebody bring you supplies. If you have questions or symptoms, please call the MCA Community Health Program for pre-screening by phone. They will schedule a COVID-19 test if needed. We are awaiting COVID-19. If you are awaiting COVID-19 test results, it's extremely important that you continue to quarantine for as long as your healthcare provider advises. We've been advised that people are getting tests and not quarantined. This is not a good practice as it puts you and others at risk. And do your best to keep up to date on the latest information, but from trusted sources. If you have questions about COVID-19 or testing, please call the Community Health Program here at the MCA 575-2341. I also want to provide some additional statistics provided by the community health nurses. Over the last 3 months since October, we received 351 calls and administered 103 COVID-19 tests. In November, we received 1,124 calls and administered 301 tests. For the month of December, we received 451 and administered 70 tests. From January 1st to January 10th, we've received 487 calls and have administered 117 COVID-19 tests. We must all work hard to keep ourselves and each other safe. In Akwesasne, the restrictions within the MCA's jurisdictions include the community curfew, which is in place from 11 p.m. to 5 a.m., and the travel radius continues to be 100 miles or 160 kilometers. Ontario is now under a province-wide shutdown, which started on December 26th and is scheduled to continue to at least January 23rd for Southern Ontario. Grocery stores, pharmacies, and big box retailers are open, but have a decreased capacity, while restaurants are only open for takeout, drive-through, and delivery. The intent is for everyone to stay home as much as possible and limit our trips outside of the home. If you must travel outside your home, it should be for essential purposes only. Healthcare, medication, grocery shopping, childcare, walking your pet, and supporting the vulnerable members of the community are some of the reasons why you should be be outside of your home. Indoor organized public events and social gatherings are not permitted at this time, except with members of the same household, and that is in Ontario. Those are all the restrictions that are happening now in the province of Ontario. Quebec is under similar confinement orders, which started on January 9th and is scheduled to last at least until February 8th. A curfew has been installed from 8 p.m. to 5 a.m. Quebec has basically the same restrictions I mentioned, the same as Ontario, but has also stated that they're willing to impose $1,000 to $6,000 fines for anybody willingly violating their curfew. It's important that everyone understand the severity of the situation. The restrictions put in place by the provinces are necessary because of public health, and other experts have expressed significant concerns with the current transmission trends, combined with the high level of consumer activities over the holiday period, has the potential to overwhelm the healthcare and public health sector capacities. In addition, we have Franklin County and St. Lawrence County in New York State, which appear to have much relaxed restrictions in place at this time. There are minimal closures and gatherings are limited to a max of 10. Despite the lack of stricter restrictions, we must be mindful that COVID-19 is on the rise in New York State as well, and precautions must be taken at all times, no matter where you shop for your essentials. In Akwesasne, we are very fortunate to be able to access essential goods such as groceries on both sides of the border. But I can't express enough that while the stores may be open in Messina and Malone, we must continue to exercise all necessary precautions. Most cases are transmitted by close contact, so it's extremely important that you maintain physical distancing and only shop for the essentials. The intent of all the restrictions is to slow the community transmission and allow for the healthcare and public health systems that are reaching critical limits to recover briefly and, if possible, to catch up. Locally, we have received word that the Cornwall Community Hospital is being challenged to meet the demand of for patient care. Our local hospital has stated that they need everyone to take all measures to stop the spread of COVID-19. Hospital capacity is being monitored daily, and some of the elective surgeries will be postponed to make beds available for emergency cases. Every effort is being made to maintain all day surgeries, clinics, and diagnostic services, but if the trend continues, cancellations may occur. The community can manage this crisis by following public health guidelines on physical distancing, limited interactions, and hand washing and masking. While it is important that on the horizon, the development and implementation of the vaccine against COVID-19 is happening, the essential care workers in Akwesasne and Cornwall have not yet received the vaccine, and we must do our part to protect them by limiting the spread. Our collective efforts are required to slow this transmission. The entire healthcare system is being stretched. Provincially, there are not enough specialized staff to meet the demand as numbers continue to soar. Cornwall Hospital is operating at surge capacity and numbers of COVID-19 cases are growing daily. The critical care unit has been challenged with high volumes over the last few weeks. While the hospital remains safe for patients to access care, it should be known that the constraints being caused by the pandemic place undue pressure on doctors, staff, and the facility itself. The next few weeks are terribly worrisome, and everyone is being asked to take precautions and stay safe. The last topic I want to discuss is the COVID-19 vaccine rollout. The Mohawk Council Akwesasne Health Department and the Community Health Program is planning for community vaccination of for COVID-19. As part of our planning process for the community vaccine, a vaccine survey has been prepared to gauge the community's response and willingness to receive the vaccine. I encourage you to participate in the vaccine survey, which is easily accessed through our MCA Facebook page. Your input is valuable and appreciated. The survey can be accessed until Friday, January 15th. There are 2 vaccines that have been approved by Health Canada, Pfizer and Moderna. Both of these vaccines are administered in 2 doses. Once the initial vaccine injection is given, it is followed up by a booster injection that is given 21 to 28 days after the first dosage. We have received word from the Eastern Ontario Health Unit that approximately 200 doses of the Moderna vaccine will be arriving in Akwesasne this week. The priority areas for these doses are the residents and staff of our long-term care facility, as well as the vaccinators and the ambulance staff. Essential care workers and first responders will be the next priority group to receive the vaccine. Our Department of Health participates in daily meetings with the Eastern Ontario Health Unit on the COVID-19 vaccination. The vaccine survey results will be used to help us assist in planning for community vaccination clinics. While we do not have a time frame on when we will receive the next doses will arrive, we are working to ensure that we are ready to administer them as soon as they are received. The start of 2021 comes with optimism on the vaccine, that it is on its way, but it will be a long time before we have what is being referred to as a herd immunity or a population immunity. This happens when the population is immune through immunization or previous infection. We definitely prefer that immunity for our community members takes place through immunization rather than infection. It has been reported that 70 to 90% of the population needs to be vaccinated for herd immunity to be effective. Right now, there is a race going on between infection rates and the vaccination rate. As a community, we need every single person to follow all of the safety precautions in an effort to slow the infection rate. We need the vaccine rate to win this rate. I cannot repeat enough that we must all keep doing our part, including wearing a mask, maintaining the 2-meter distance from others when in public, and avoid physical gatherings when with others outside of your household. Breen, that is everything that I wanted to cover in my report this afternoon. I open it up to questions from you or the community.
All right, thank you very much. Again, we're talking with Mohawk Council of Akwesasne, Grand Chief Abram Benedict. This is CKON Wednesday to Watala. If you did have a question for the Grand Chief, you can always give us a call here at the radio station so that we can get your question to us and answered. They don't take them on that Facebook live feed, which is taking place right now on the MCA page. And I've also just shared that with the CKON Facebook page as well. So talking about Mohawk Council of Akwesasne's COVID-19 response. The first one, of course, you made reference to Quebec and Ontario with the different things that they're doing province-wide. So we had a lot of people over the weekend wondering, okay, SNI and St. Regis are in Quebec, so to speak. Are we having to follow the Quebec curfew, which begins at 8 p.m. in the evening? So how does that work? And do we need to follow that curfew, or do we still stick with the one that is being regulated and guided by the Mohawk Council of Akwesasne?
Thanks, Serene. So back in April, we instituted our own community curfew law that provided for, at that time was 10 p.m. till 6 a.m. And also provided that persons that live within the community should not travel at that time was outside a 50 mile radius. Since then, it has been varied. So now in November, we reinstituted the community curfew from 11 p.m. till 5 a.m. And that is the curfew for the entire community. So Quebec has instituted a different curfew. We here follow our community law, which says 11 p.m. till 5 a.m.
Another question with regards to that curfew. Someone feels that the 11 p.m. curfew that's been installed to help turn the curve of COVID-19, how good is that curfew now that we're seeing this explosion of cases, so to speak? Southern portion of Akwesasne, no curfew. Messina, Cornwall, no curfew. So someone wants to know why the northern portion of the territory has that curfew from 11 p.m. to 5 a.m. and knowing that it's not helping the affected individuals that are testing positive and the spread of COVID-19.
Mm-hmm. So the curfew is a tool that we use as part of, as a tool to help slow the spread. Unfortunately or fortunately, there is not a lot of community businesses operating in our community after a certain hour, and probably around 9 p.m. When the corner stores may close, 10 perhaps. Because of the location of our community, we don't have a lot of traffic flowing through the area. Again, the curfew is a tool. If there are people gathering at night or having gatherings in the evening, this is, the curfew is really to deter those sort of activities. With Quebec instituting a curfew on Saturday, there has been lots of conversations about curfews. I actually gave an interview earlier in the week with a radio station in Montreal talking about our community curfew specifically and how effective that has been, or if it has not been effective at all. And it is a tool. It's not going to be used for it's not going to stop the spread, but it will slow the spread. And, people people that are out and about in the community after 11 o'clock, it likely is for essential reasons. If they are out past those times, not for essential reasons, then there's probably something more going on, and the police services, will make those interventions necessary. It's only a tool at this point, the curfew.
Thank you. Taking a look at our emergency response to the pandemic itself, with your emergency operation center and officials that are the first responders and whatnot. In your planning, the strategic planning on how Mohawk Council of Akwesasne is going to address COVID-19 and the pandemic in our community, is there a threshold of number-wise that we're going to get to where we might get into another phase of more restrictions, more guidelines, maybe lockdowns, things like that? Do you guys have a threshold where, because total cases, I think right now, off the top of my head, I don't know if this is correct or not, but total north and south together is like 50 cases of positive individuals who have contracted the COVID-19 virus. So are we to get to a certain number, say, for example, we get to 75 or 100 current active cases? Is there a threshold that you have as part of your plan? Do you know?
There isn't a threshold per se, an exact number that says, once we hit X number, we do this, and then X number, we do that. But it's a bit of a metric system where we analyze what the region is, for one, what the region response is, and then also what the regional hospital, which would be in our case, the Cornwall Community Hospital, what their ability is to respond. And the health department makes recommendations to us, including our EOC, on some of the additional measures we may put in place. The MCA right now is currently not open to the public. There is a lot of staff that are working from home, that are able to work from home, because we want to limit the risks of workplace transmission. Workplace transmission as well is a consideration that we examine when looking at if additional restrictions will come in place. Reen, the challenging part is for us, and I mentioned this in my update, is that south of us there are minimal restrictions, and that includes within the two counties, Franklin and St. Lawrence, including under the tribal jurisdiction. Unfortunately, human behavior kind of goes to where the less restrictions are, right? And that's why we cannot express enough that we need to stay home. While, it may be enticing that we want to go to the Walmart and look for, other things that are not essential, we really need to think about, those decisions before we make them, because there is just too much transmission happening. So the other factor that we put in place too is what are the restrictions around us, right? So if we continue to put more restrictions on the northern portion of Akwesasne, people will just continue to go south more, right? And that's why the curfew is a tool that, we have put in place so that, there's not traffic, tempted to go to different parts of, upstate New York that may be open later for leisure reasons, right? And so there's not an exact number to it. There's a lot of metrics that are considered when these decisions are being made as well. We do rely on our health department locally. We rely on the Eastern Ontario Health Unit, and as well as what the provinces are doing as well to help slow the spread of COVID-19, because the reality is here we have to rely on the city of Cornwall for health services as far as the hospital goes. Those day surgeries are extremely important. The testing, the diagnoses that are happening for our community members, extremely important. So, when they get to the point of not being able to do that, that really is a bit of a critical. But again, it's challenging because, south of us, there's minimal restrictions. So, we can't press enough that people need to think about what decisions they're making for themselves and that impact that it may have on them and our community.
All right, another question. Will we hear from health officials or our doctors regarding a COVID-19 update for Akwesasne? I'm assuming they're mentioning and referring to the Mohawk Council of Akwesasne jurisdiction for the community health program, holistic health and whatnot. So will we hear from those health officials?
We can absolutely bring them on and to provide an update and answer more of the health technical questions. At this point, we don't have them scheduled, but it's something that we can work on in the next week or so.
All right, looking at employees for the Mohawk Council of Akwesasne, will employees be required to get the vaccine, or is it going to be voluntary for the employees of the Mohawk Council of Akwesasne?
It is my understanding from the MCA administration that no employee is going to be required to get it. Obviously, employees are going to be encouraged to get it, especially the ones that are in the vulnerable sectors, the ones that are in the homes. But at this point, it is not going to be mandatory for any employee to get it.
All right, another question with regards to employees. Is Mohawk Council of Akwesasne supporting its employees, or are there talks of layoffs?
At this point, if any layoffs have occurred, it's been because of contracts have ended. There have not been any mass layoffs. I think at this point, as I mentioned in my report, we feel that, there is a light at the end of the tunnel. Hopefully things will start going the other direction as vaccines roll out, as the vaccine rolls out in our community and around our community. But in the meantime, the administration of the MCA is making all accommodations that they can for people to be able to work from home, to be able to provide the services that they need to provide within the organization to the community as well, by appointment or virtually. But this is really is a day by day planning that the administration has been doing. We do not want to have layoffs in the community, because it only creates other problems within our community. So the administration is super conscious of this as we go forward. Hopefully vaccines continue to roll out on both sides of the border, and that there is an effect on that, and having a positive effect, meaning that the virus is not being transmitted anymore because people are now immune to it, or have the vaccination, and we can really start looking at resuming some of the normal things that we used to do. But we're probably a few months out before that.
All right, so I do have some more questions with regards to the vaccine, with regards to Junkanusa, our long-term care facilities, and also with regards to schools. So we will continue, since we've been making reference to MCA employees. The way the question is worded, I'm going to word it a little differently, so that I don't express things that aren't correct. So I have a few of those. So the question has to do with essential employees working at our 24-hour facilities. So is Mohawk Council of Akwesasne supporting our essential employees overwhelmingly when it comes to salary? So is Mohawk Council of Akwesasne supporting our essential employees overwhelmingly when it comes to salary?
There are, so all employees that are essential for the Mohawk Council of Akwesasne have been receiving COVID essential pay, as well. Some positions, healthcare positions, mainly, are receiving an hourly increase that has been mandated by the ministry, so that they are all receiving that as well. So there are some financial supports that are being put into, that are being given to the essential workers within the MCA. All workers that are continuing to work within the MCA are receiving some additional compensation. We provide, there is some employee services that are available for those who may be struggling with depression, burnout, things like that. There are contractual services we have that have been made available to them. I do want to say that, hats off to all of our long-term care workers, our healthcare workers right now. It was extremely difficult to be working in this pandemic, but now that we have an outbreak in our long-term care, I know that the pressure is on them even more, right? I mean, very sad news that that 4 residents have now passed away as a result of the COVID-19. That just mounts more pressure on top of those workers that are going there day in, day out to take care of our residents. And I do want to thank them for that. And that shouldn't go unrecognized. But back to the question, there are some financial compensations being provided additionally to those workers.
And next part of that question would be, since we do have deaths and we do pass along our condolences on behalf of our community to the family and friends of those who have passed at Chief. Since that happened, the degree of dangerousness or dangerous work conditions because of the virus being in the facility, is there something that is being considered to raise their salary even more for those individuals that work in those 24-hour facilities?
Not that I know of offhand that there are any additional compensations being provided at this point. Some of them are ministry driven, some of them are the MCA driven. That's something that the administration can consider. As far as supports as well, I do know that the Eastern Ontario Health Unit is providing guidance and support as far as how to deal with it, an outbreak in the long-term care regularly with the staff and management at the long-term care facility. So there are, while financial does help, there are other supports that we are relying on as well to support just to get through the outbreak at this point. I think that once, we're over the pandemic, we will be giving lots of people, recognition for the hard work that they've been doing throughout all of this day in and day out. And no doubtably, all of the workers in our homes will be the ones on top of the list.
Now, there's been an increase in children with positive COVID-19 results. What is MCA's plan to safely return children to our AMBI schools?
At this point, all of our students have been and continue to be learning online. February 1st is the tentative return back to in school. It's also we should also mention that parents had the option of having in school or totally online right from September. So there was a bit of a hybrid, we call it a hybrid model happening in November. We went straight to online. And now, February is the tentative. This date could change, at any time. We're continuing to monitor. The Akwesasne Board of Education continues to monitor the cases around us, what, impact that has for the region. If they do return to school, it will be in accordance with, all of the health guidelines that are available, making sure that all of the protective PPE is available to the children and to the staff. But this timeline still continues to be examined as it gets closer. We're still about 2 weeks away from that date. I encourage people to continue to listen for updates on that, whether or not that date will change. But there's a lot of factors that are being considered. We want our children to be safe. We want our entire community to be safe, but we also don't want, a school to be a transmission place for the virus for the children to take it home and then thus cause more havoc on our community.
Will, do you know if schools are planning to require the vaccine to attend schools like other immunizations? And wondering if that's going to go into a factor, if that's been talked about, or if that's something that we're looking at. Will schools require COVID-19 vaccine to attend school like other immunization?
No, not at this point, no.
All right. So again, we're talking with Mohawk Council of Akwesasne, Grand Chief Abram Benedict, and we're talking about the COVID-19 response from the Mohawk Council of Akwesasne. And our next question, the curfew and the radius, does that apply to everyone? And this caller alleges they've seen chiefs on travel outside the community radius.
Mm-hmm. So currently the travel restriction is 100 miles or 160 kilometers. If you travel outside of that radius and you live under the jurisdiction of the Mohawk Council, you are required to quarantine for 14 days to ensure that you haven't brought the virus back into your home and back into our community. But at this point, we're saying that we really should just be traveling for essential reasons. Like back in April, when the pandemic first started, we've seen lots of restrictions in place, and people were staying at home. We're really asking at this point people to continue to do that as well. We're at the point we're at right now, and that's simply so that we can alleviate the healthcare system can receive a bit of a reprieve. That the transmission hopefully will slow down, and that the vaccines can get rolled out to the people that are wanting to get them to protect themselves in our community. So that travel radius still continues to be 100 miles or 160 kilometers. And we will continue to examine that if needed as we move along, in hopefully seeing things turn in a better direction.
Another question: who is the Mohawk Council of Akwesasne Director of Health?
Currently, our Director of Health is Keith Leclerc.
And second part of that question is he available in the community? They understand that he is back in his home community. And if he is, when will he be coming back to our territory?
Well, that question is more of an administrative question. I don't direct the workforce, the executive director does, but it's my understanding that some employees have been accommodated to work from home. But I understand that the director of health is now is here in the community working with the workforce.
And another question with regards to fatalities. We've talked about CKON over on Cornwall Island. It's our long-term care facility. And unfortunately, this week we've learned, and actually as of yesterday and today, we've learned of the third and fourth resident who have lost their lives at CKON. They would like to know, are fatalities included in our resolved cases when we see the numbers that are provided? So are fatalities included in our resolved cases here on the territory?
That I'm not sure. We'll have to check to see if those are included in there or not.
All right. So another question: where do elders sit on the priority list on receiving the COVID-19 vaccine?
I just received a message here from our staff, and yes, they are in the resolved. So back on your other question, our elders. So the way the priority listing has been designed by the province. Now this is, I was just speaking or going back and forth with Dr. Paul, who's the medical officer of health for the Eastern Ontario Health Unit, regarding priority listing. And so the ministry through Ontario has put out, some guidance documents, and what it has been so far is that long-term care residents and health care workers who are providing the services in the long-term care residence. After that is then it's healthcare workers, and then it goes into First Nations, and which will be elders. So essentially, the priority listing that we have said would be the healthcare workers first, all of the people providing supports to the long-term care, all of our nurses, and then going into after that will be vulnerable age group, which is the elders. So that is how the rollout will begin, and then we'll go from there.
Does Mohawk Council of Akwesasne or the Department of Health have any COVID-19 vaccines in stock? And will there be any inoculations in the northern portion like there are in the tribal jurisdiction?
Mm-hmm. So the way the vaccine rollout is occurring across Canada, it's being administered by the provincial government. So the provincial governments are in charge of infection control. So the vaccines are coming into Canada, then being distributed, or well, in fact, divided up, because at this point there's just not enough for every person in Canada to receive it, but they continue to receive more vaccines every day. So what happens is that they provide an allotment to Ontario, and there is a specific allotment within that allotment for First Nations, and then we have a specific allotment in there as well. It has been a bit slow rolling out into Ontario and essentially into our community. But I've been advised by Dr. Paul that the vaccine will be tentatively here in our community by Friday. Also recognizing though that the Pfizer vaccine, which is approved by Health Canada, requires it to be held at a very extreme negative temperature, like minus 80, which is not something that can be achieved by a regular freezer that you would find, in a home. So this is a specialized medical freezer, which then just created a bit of logistical challenge in getting the vaccine rolled out to certain areas because they don't have the equipment. The East Ontario Health Unit does have a freezer in the region that they can use for the Pfizer. So just recognizing that that was a bit of a challenge, but now I understand that the Moderna vaccine, which doesn't require to be kept at a low temperature, will be the one that we'll be receiving here. That will likely be the one that all community members will receive, simply because we don't have the freezer here. We do have access to one. It just creates a bit of more logistical problems, but those are some of the factors that have been in play in the delay in getting the vaccine here. But I understand that the amounts available are continuing to be made available, and once it starts, then we should be able to continue to roll out the vaccine program or immunization into our community.
What is council doing to prevent a COVID spread in our health facilities like the clinic or the old age homes? And they would also like to know, what are the consequences? And I know it's difficult for the last few weeks with some people using blame. Some people are blaming people for, alleging that they're not following health protocols, that they're not doing these things, and that's how it's getting into our community and things like that. So we would like to preface this question by, we're passing it along. This person says, what are the consequences for health staff that don't follow health protocols that unfortunately are allegedly contributing to the spread of COVID-19 to our elders?
So the long-term care facilities do have an infection control plan that has been developed for a number of years, because it is required to have it for a long-term care facility. This document should have been regularly reviewed with the staff as part of their professional development. So when the unfortunate incident occurred that we did have a positive transmission into the home, that's when they would activate the infection control manual to be able to protect the residents and protect the staff so that there's not additional transmission. All of those protocols are being put in place to ensure that everything is being done. The Eastern Ontario Health Unit meets regularly, as I mentioned earlier, with the long-term care facility to be able to provide any guidance that they may need. They have come in to the long-term care facility to do some additional supports as far as a review, answering questions, taking a look, a bit of an inspection. If things do continue to get worse there, they will, the hospital does have a unit as well that they can deploy into the long-term care facility. It's a very difficult situation, that they have been placed in, the home has been placed in. In fact, 70% of the fatalities in Ontario have been related to long-term care facilities, which, shows that it is a vulnerable sector. So we are doing everything that we can to make sure that the staff have the support they need, the management have the support they need. to be able to continue to move forward and to hold on until we can get the vaccines rolling out, which will hopefully happen this Friday. As far as, who will be held accountable, that is a very difficult decision, because there are, we have we've had almost 100 cases in our community now, and who's being held accountable for that as well, right? It is on each of us to make sure that we're doing our part to slow the spread, because this virus can transmit from one person to the other without even knowing, innocently knowing, right? So that other person you could be standing close to or having coffee with in your home, or even just crossing paths with, you could transmit the virus to them, and then they walk into their off, into their workplace and take care of the long-term the dudas in the home, and it innocently happens. So at this point, we are doing the best that we can to provide all supports, make sure that everybody's kept safe. Once we get out of the woods, we can then take a look at what we could have done better, or what we did well, and then learn from there. I can't speak specifically to if people will be held accountable. That is administrative, but I know that they are doing the best that they can at this time to deal with the situation at hand. And when we're past that, then we can look at what other things should have or should not have been done.
Well, I got to tell you, it must have been quite a strain when it comes to the feeling of responsibility for individuals that work in our facilities, because they have the biggest hearts. They love the residents. They care for them every day of the week, every day of the year. And for that added responsibility now that, they could catch COVID-19, it just must be so overwhelming for them. And we appreciate all of the hard work from all of our workers, whether it's nurses, PSWs, counselors, anybody that's in those 24-hour facilities. Thank you so much for the extra mile that you've gone, and for keeping it all together. Because again, we talk about our businesses having to change their delivery method for, how they deliver their products or services to the community. Our long-term care facilities, 24-hour facilities, have to, it's almost like they're their own little town, or their own little entity. And they have to keep everybody engaged, and keep them fed, and keep them with their meds, and taking care of them. And also having to go that extra mile for the social aspect, because we can't let people in there. So I just wanted to send a thank you to everybody that's involved with taking care of everyone, whether you're at Yakisota, June Ganusa Day, you're at the Family Wellness Program, wherever you are, that you're helping out our community members. Thank you so much for that extra mile. Another question: MCA protocols say that employees should not gather. And this person wants to know, does that apply if they go to the casino?
Well, at this point, we've said to all the employees, we've said to all the community, we need to ensure that we're being safe. Again, when I spoke earlier about how challenging it is for us because we're on this wonderful border, right? The border, we have provided us, some benefits. And at this point, I would say that it's providing a bit of a disadvantage, because north of us, everything is shut down. You will not find, at this point, you will not find a Home Depot open. You'll find a Home Depot and a casino open. You will not find a casino open in Ontario. In fact, in Quebec at all. And we'll find one here. So there are some big differences between north and south of us, and that is just a reality that we have to deal with being in Akwesasne. It's my understanding that all the businesses in the the southern portion and the counties as well have to follow certain guidelines established by the offices of the health departments to keep their clients safe. I believe that the Mohawk Casino follows the same rules. In fact, I've heard that they do additional over and above to keep the place clean, but it really is on the individual person. Now, there is nothing that prohibits any of our staff from going there. But if they are gathering, that's a bit of a problem. We want people to not be gathering, but we also want them to be staying home as well. I can't tell people to stay home and while these things are available for them, but I can tell, what I can say is that I hope people are making the right decisions for them and their family and our community ultimately, because the effects are devastating.
All right, I want to let everybody know we're going to wrap up at 1:30 the latest. I do have some more questions that continue to come in. So at 1:30 we will wrap up, and if I do not get to someone's question, I will make sure that we get it to the Grand Chief. I will get it to his executive admin, and they will pass it along to him so that your information does make it to the Grand Chief. So I apologize if we don't get to everyone's questions, but again, we're going to wrap up at 1:30 at the latest. So another question, again, we're talking with Mohawk Council of Akwesasne Grand Chief Abram Benedict, and we're talking about MCA's COVID-19 response and the different aspects and angles of it. There's been so many different ways to look at the pandemic and how it affects us as employees, as community members, as families. There's just so much. Parishioners, midwinter's coming up, and that has to be changed, the way that they deliver that. It's just been so much. So as we continue to go through and take care of one another each and every day, the Mohawk Council of Akwesasne has employees that are working from home. Are they being compensated or reimbursed for increased internet usage and expenses by MCA or the chiefs?
Um, as far as I know, that the employees are not being compensated unless there are situations where they don't have it and they need it. They were then provided with the tools to be able to access it. I don't believe so at this point that employees are being compensated.
Now, speaking of the internet usage, how are things going in Sinai? I know we're laying the hardware for the fiber optics and working in that district. How are things going?
As far as I'm aware, they are going well. They began last week with being on the ground, started doing underground laying of the fiber lines. This is a project that has been several years in the making. In fact, we received approval, I believe, in 2018 or 19 from the federal government for some funding on this. We have been going back and forth with them since then about getting final design approval. But in the meantime, we've made the decision that we'll be making a financial investment to start the project sooner than later. They will provide some funding they'll provide the funding for the project at a later date, but we weren't able to wait any longer. So I know that they had an information session on Monday to share an update on that. I hope that the community was able to participate. If not, I know that it will likely be available on our Facebook page for people to listen in. There is a survey happening so that people can provide information to the team so that we know what the interest level will be, what some of the challenges may be for the planning of this. But as far as the project started, it is underway. There are boots on the ground. People are beginning the construction phase. It is an exciting initiative amongst all of the other challenging things we have to deal with, because I know that in all of our districts, we continue to receive calls about bad service, no service, slow service. And I look forward to the day when, some of the gamers that have called me up and said, I can't play this certain game because there's not fast enough. And, I can't wait till the day that we have the speed fast enough for them to be able to do that, including, some of the e-commerce that may be available for people in the near future, because we finally will have fiber starting in Snai, and it will be expanding to the rest of the community. It's just we had to start somewhere.
All right, another question. If our health department is using the Eastern Ontario Health Unit Directive and guidelines, do they apply to all of the northern portion? Because we do have portions of our community that are labeled as Ontario. We have two other portions of our community that are labeled as Quebec. So how does that work?
Several years ago, we signed, the provincial governments between Ontario and Quebec signed an agreement that Ontario would be covered by all of Akwesasne on the northern portion would be covered under the Ontario Health Unit, Eastern Ontario Health Unit. The reason for that is that there are different processes and protocols, the way the provinces deal with certain things differently between Ontario and Quebec. And one of the things we've always been challenged with here in the community is we want to have the same level of service no matter where you live, whether it be Sny, St. Regis, or Cornwall Island. So the governments agreed that they would be all covered under Ontario as far as health authority goals would be under the Eastern Ontario Health Unit, recognizing though that a lot of those services are already delivered by our health unit here, the community health team, with the guidance and support of the Eastern Ontario Health Unit. So now that we're dealing with a pandemic, in fact, the way they deal with infection control is completely different between Ontario and Quebec. And we couldn't have a position where, residents of Cornwall Island and residents of Akwesasne would be treated differently because of where they live. We have enough of that already, and in areas that we could make it better, we pursued that several years ago. So it is all under Ontario directives.
All right, so I'm going to close the phone lines now. So no other further questions will be taken. I do have a bunch in front of me that we're trying to get through one by one. And again, the Grand Chief will be joining us until 1:30 only. So I'm going to use that as a cutoff point. So again, the phone lines are now closed to questions for the Grand Chief. Our next question: would council consider a per household payment from the Akwesasne Community Settlement Trust? If there ever was a time to access it, now would be a good time. This person feels even the charter and parameters of the settlement fund say it would be an appropriate action to do. Will council look into that, getting some money out of the Akwesasne Community Settlement Trust to help those under the jurisdiction of MCA with money?
It's something to consider, is going to the trust. Of course, the trust does operate under priority areas. They do have some monies that is set aside for emergency response. I'm not sure that that would fall in those parameters, but it's something we can examine. Unfortunately, the timelines for application may not fall in line with this right now where we're at, but we can explore that to look at what may be available.
And another question: why have family members been let into CKON? They feel, this person says, it is not in our best interest to keep everyone there safe from outside spread.
As far as I understand, that all visiting has been suspended, and it has been for several weeks now. If there is a specific situation where a community member or a family member was let into the facility, I would ask that they please follow the MC administration to find out if it is in fact a breach of process or directive. There could be situations where it may have been warranted. I don't know, but if they feel strongly about that, I ask them to please reach out.
CKON, what's the ratio of Akwesasne Mohawks versus non-natives that are at CKON? Do you have any numbers on that? And were all of the 4 passings from CKON, were they Akwesasne Mohawks or non-members?
It's my understanding that the ratio at the long-term care facility, CKON, is about 50-50. So half of the residents is from our community and half are non-Indigenous. As far as the deaths that have occurred, that I don't know offhand if they were all residents of our community. But given the ratio, it's likely that half would have been.
Is Mohawk Council of Akwesasne doing anything to accommodate our essential employees who haven't had a day off since March, or can't work from home, or can't take time off because this person feels there's no coverage in either? Will they get a pay raise or time off? I know, Grand Chief, that we've covered this a few times, but We probably have some listeners that are just tuning back in. So quickly to answer that question.
Yeah, there have been additional supports, financial supports that have been provided since the earlier on in the pandemic. There are all essential employees at the MCI are receiving a certain amount, a percentage top up, and there is a amount provided by the ministry, $1 value per hour that's being provided to the staff by ministry requirements. So there is some being provided. Whether or not there will be additional, I'm not sure at this point. But I can tell you that, we are looking at trying to find additional staff as well to work in the facility. We may have seen that we had a general call out for applications for people interested in various areas. We asked you please provide your resume there. The same is continuing to apply for healthcare workers. There may be some situations where people aren't able to take time off because we don't have anybody to fill that when they're not there, and the need is there. Unfortunately, that is a common thing that's happening right across the board. You see it on the news all the time. I speak to the Indigenous Services Canada about this all the time. They are having a hard time finding nurses, PSWs to be working in all clinics, all long-term care facilities on First Nation communities, and the province is struggling with the same thing. So we're actively trying to find additional people. But the financial supports are there. Will there be additional? We will, I can bring that back to administration. And if there are any ministry directives, that will happen.
Have you heard of any fines or even charges for individuals if they know that they have tested positive for COVID and continue to go out into public or continue to go to work or continue to go anywhere? If they've been determined to be a positive for the COVID-19 virus. Have you heard anything or any stories about that? Any information, reports that in that case something has happened like that? And are they charged criminally or, civil-wise? Are they given a fine? Have you heard any of that, or has there been any discussion on that?
So there is a couple pieces of legislation, the Ontario Public Health Protection Act, and there is the Quarantine Act of Canada. So under those two pieces of legislation, more so the Quarantine Act, the federal government has, and it is, taking people that won't quarantine and putting them in quarantine lodgings. So there may be not being, whether or not they're being fined later on at that time, but people who are not listening to the quarantine requirements, as far as they're required to quarantine when they come back into the country, if there have been cases where they'll take the person and put them in a facility to quarantine there for 14 days. Locally, no. Those are kind of extreme cases, but those are mechanisms that are available under certain situations here. We really rely here in our community on people to stay home and do the right thing if they are positive, because the implications to us is much greater than them just having to be out for whatever reason it may be.
And another question: how safe is it for people to go pay their respects at funeral homes for those who recently passed away?
Mm-hmm. So in Ontario, there, I understand that if there's a wake or a death in an Ontario, using an Ontario funeral home, they only allow the very immediate family. And these are situations what they call as attendance controlled environments, meaning that only certain people can go in. On the American side in New York, there's also the same thing, attendance controlled environments where only so many people are allowed to be going in at a time. Obviously, this has been a super big struggle for all of us. It is in our custom and who we are as Mohawks, that we want to be able to console people physically. We want to be able to provide supports to them, to the family at the time of loss. And so now we've been super challenged by we can't do those things that we used to. So now, we have to respect the situations where there's only so many people allowed to go into the wake services. There can't be large gatherings for the funeral, gravesides, things like that. This is something that we need to be very conscious and cautious of when we do those things, and we need to respect the directives and protocols to keep yourself and the family that's grieving safe. We have to make those individual choices, but those are the reasons why there are the public guidelines, and they say that attendance controlled. So.
Another question. I'm an employee at one of our long-term care facilities, and they say they were told if they contract the virus, they will get sent home without pay to self-isolate, quarantine. Do you know anything about this? Can you look into it? Meanwhile, other MCA employees get to work from home and collect their pay.
Yeah, I don't know specifically what the arrangements are for if somebody contracts it and is required to is an essential worker. It is something that I can follow up internally with and find out the answer.
All right, and our last question, and then we'll turn it back to you, Grand Chief, to close out our program today. Will community support clients be receiving any more COVID money?
As far as I know, they will not at this point. They did receive some additional at last month. Some of these are also driven by whether or not we receive additional supports for certain groups in the, i.e. the community support clients. I know that there was some additional resources received to be able to do that. If that becomes available, we will make it available to them, but I don't know at this point if there any additional will be. Hopefully, again, Reen, we are seeing, the light at the end of the tunnel, and things hopefully in the next, 3 to 4 weeks will start getting better. We are really at a critical point right now that we just need to sit tight, be safe, to be able to keep ourselves safe and our community safe.
All right, so that wraps it up question-wise. So we're going to turn it back to the Grand Chief to, with his closing comments, and bring to a close to our program today. Thanks again to everyone that phoned in questions today for participating in today's program, and also to the Grand Chief for answering all of those questions and for his presentation earlier. So Grand Chief, with your final closing notes, please.
Absolutely. So these past 10 months have been extremely trying for all of us, but it's not over. As I've mentioned a couple of times in our presentation, we feel that we are at a bit of a critical juncture here. We see the light at the end of the tunnel. I know this has not been easy. It's not been easy for me. It's not been easy for anybody in this community to be able to deal with the pandemic that we're living in right now. But we have to continue to take this one day at a time and support each other along the way. There is some relief on its way with the vaccine, but we still have to continue to hold tight a little bit longer. Reen, thank you as always for spending time with me this afternoon. I want to say Yamagoa to all of our employees, our healthcare workers who are working hard to keep our community safe. And thank you to our listeners. Thank you to our listeners who are calling in and asking important questions. Our listeners who are doing their part to keep our community safe during these very extraordinary times. Without each of you doing your part, we may be in a worse off position, but let's give ourselves a bit more time, and hopefully, in our next report in about a month, we will be able to have a bit more positive news that we are seeing a decrease in the cases, and that the vaccine rollout is well underway, and that we are in the swing of a positive upward in this pandemic that is continues to challenge all of us each and every day. So, Yamago Akwesasne, and thank you very much, and we will get through this together. So, Yama.